Hello, my name is Shar Jones, and today we'll be discussing the topic of abortion. I will be taking the position of pro choice, while my opponent, Jennifer Dixon, will be taking the opposition in pro life. Abortion, defined in the medical sense, is the deliberate termination of human pregnancy, usually within the first 28 weeks of pregnancy. It is easily one of the most debated topics of all time and has really caused rifts in not only the Christian community, but communities in general. It is really impossible to talk about abortion without referencing the case of Roe versus Wade, which in 1973 gave an individual the liberty to have an abortion. But in 2022, that decision would be overturned, stating that on a federal level, the constitutional right to abortion would no longer exist, and referenced it as an abuse of power on a decision dating back decades. Now, during times of sexual revolution, abortion was often referred to as a means of birth control. The opposition will tell us that pro-life argues that because life is sacred and all life is valuable, it does begin at conception. The opposition will also argue that abortion is the same as killing an unborn baby. However, the pro-choice side stands for the ultimate autonomy of a woman making a bodily decision regarding any reproductive decisions. Pro-choice often sees pro-life advocates as only concerned with the life of an unborn baby and really callous towards the lives and bodies of women. I do not support abortion as a means of birth control. However, under certain circumstances, I do feel it is the right decision to hand that decision to the individual over their own body. For instance, in certain areas saturated with poor social determinants of health, high crime rates, low education status, and lack of access to education resources and funds, women can be victims of certain circumstances, meaning victims of rape, human trafficking, prostitution, molestation, and other traumatic, terrible events. Women can become pregnant under those traumatic means with no choice in the matter, no resolve. I strongly believe in those situations, a woman should have a right to choose. Ethically speaking, a woman forced to carry a baby for 9 months created from those circumstances has the potential of creating a downward spiral psychologically, emotionally, and mentally. In reviewing the support need for these vulnerable populations, as a public healthcare provider, it's important that I understand my care recipients' cultural and moral beliefs and what they need for support. Abortion under those circumstances certainly provides autonomy and can alleviate suffering from the care recipient's perspective. As a healthcare provider, I take an oath. I take an oath to put the patient first and to advocate for their will in their care. If pro-choice is the decision at hand and it supports a woman's need to take ownership of their body for reasons that ultimately could save her life from subsequent trauma, then I am for it. There is a need to protect these care recipients from complexities of their own lives. Though I understand that pro-lifers will argue that regardless of the situation, a woman has a duty to be a mother to a child who did not ask to be there, there is still an ethical code that must be examined in the wake of those decisions. The decision should remain with an individual, their needs, supporting rights for persons, and providing justice in the idea of equity and control over their body. It is their individual body. Thank you.